You're on mute.
Yeah. Thank you for joining us this afternoon. I'm Farrah Hunt Thompson, Director of Consulting for Greystone.net. I'll be going over some housekeeping items before we get to the presentation this afternoon. After the presentation, we'll be taking questions from attendees. To ask a question, please use the toolbox on the right side of your screen. And due to the size of the audience today, attendees are in listen mode only to cut down on background noises. There will be a short survey after the webinar, and we would appreciate your feedback. I'm now going to turn it over to Mike Schneider, Principal and Executive Vice President of Greystone.net, to start today's discussion.
Thanks, Farrah, and welcome everyone. And as Farrah said, I'm Mike Schneider from Greystone, and I'm excited to be here today. And we've got a variety of folks that are on this webinar today with us as well, and I'm going to take a second to introduce them in just a moment. But I thought I would start out by just talking a little bit about what got us excited about this topic. We've been working together with the folks at Reason One, and today Lauren Miners, the marketing manager at Reason One, is on the call with us as well. And Lauren and I worked on some research. One of the things that we like to do is conduct some research amongst providers about some of the hot topics in healthcare, and so disruptors came up as a topic in our list. And you know, we see it a lot, we hear it a lot these days, the Amazons and the Walmarts. And I was going to say, you know, I found this article online just a couple of weeks ago about CVS and their declaration that they want to own the entire spectrum of someone's healthcare journey. And so I think that speaks volumes in terms of where their heads are as corporations. So what we said was, let's do a little research and find out where healthcare providers are in this journey, how urgent they see this as a threat or a strategic need in the organization, and what are they doing in light of the fact that disruptors are coming. And one of the interesting things that happened along the way is that we discovered that healthcare providers, while they recognize that this is a threat and they do recognize that disruptors are coming, they're not moving very quickly. And so we're going to show some of that data to you. But something interesting kind of happened on the way to make this presentation, which is that we also started to realize there's a great deal of information that's out there in the market today, and especially in our own industry, from a variety of different studies and different organizations that are showing that consumers recognize that there are disruptors in the marketplace, and they're actively moving towards those providers of healthcare to receive their care. So the barriers are coming down, and what we're seeing is that healthcare consumers are starting to utilize some of these services. So we reached out to some of our colleagues at Klein Partners and Feedback and Core Health. So we've got Rob Klein from Klein Partners, Dean Browell from Feedback, and Laila Waggoner from Core Health, who are also joining us and sharing some information from some other studies that they've conducted. So this is kind of my long introduction to say that we actually have three sources of information today that we'll be utilizing as we discuss the impact of disruptors in hospitals and healthcare systems and healthcare across the country. One of those resources is going to be the study that Greystone and Reason One conducted with providers, and that's adjusting your digital and organizational strategies to compete with disruptors. And then Klein Partners, Feedback, and Core Health conducted a study called Disruptive and the Traditional, What Do Consumers Say? So we'll be utilizing some of that feedback. And Klein Partners and Greystone partnered together on the annual digital healthcare marketing report, which is also some data from providers. So we'll be including some of that data too. So again, you know, we're all data people. We say, you know, put your money where your mouth is, and that's why we wanted to bring these studies to light as we start to discuss it, because we're all not very quiet people. We're all kind of A-type talkative personalities, and we've got a lot to say about disruptors, but we want to be able to back it up with some of our data as well. So to start off with, Lauren, I'm going to turn this over to you, and I'll kind of run the slides, and maybe you can talk a little bit about some of the research that we conducted and the findings that we have from our research.
Yeah, sure. Thanks, Mike. Yeah, so like Mike said, we were all very curious about this and started having these conversations and wanted to connect the dots and find out a little bit more about not just, what are systems doing about this, but what are they doing in a digital space? Because as we are all consumers, we live our entire lives on this. This is going to end up being a digital problem for systems to solve. So we asked generally, what is your system level of concern regarding disruptors? And what we found that was most systems are either moderately concerned or it's kind of not on their radar. If you want to move to the next one, which was surprising to us, given that what a big topic this is in the industry right now. What was more surprising was that although they identified as being kind of concerned, half of them recognize that this is either right now having an impact to revenue or is going to have an impact to revenue in the very near future. Next. And of those people, of those respondents, only about 30%, 37% are actively doing something within their system to position against those disruptors. So just to kind of paint that picture again, most systems are not super concerned about this. They're not perceiving this as an imminent threat, but they're seeing an impact to their bottom line. And then even less are actively doing something. And that's not just digital. This is speaking to the entirety of their strategy. So what's nuts about this, right? So Mike mentioned this article from CVS Health wanting to own the entire spectrum of healthcare for the individual, because they have recognized that customers already trust them with that. They built that trust over decades being a retailer. And then, y'all, the call is coming from inside the house. Systems themselves are spinning up these innovation centers that are going to start competing nationwide. So we have Alina Health recently announced, just in the last couple of weeks or so, that they've been serving their 4,000 patients in their footprint with inbound help. They're dedicating $20 million to spin this up nationwide. So now you have healthcare systems that were never on your radar that are now going to come for your patients. Next slide. So we kind of wanted to know, all right, what does consumerization mean to systems? How are you looking at it? It's a big topic in the industry, but what does that mean, and how are you putting that into practice from a strategic and digital standpoint? So you see on the screen, we have reducing, and I'm sorry, Google Slides cuts things off. So reducing barriers to care is the top one. On-demand access, consumer-centered content, and transparency. And I want to also flag satisfaction with care, which is like near the bottom. Those kind of all seem like things that consumers just expect from their digital experience with a healthcare system. These are table stakes. They're things that should absolutely be in practice, but it's not truly moving towards a consumerization ideal. It's not really embodying that philosophy. The items that are in yellow and teal: conversion, speed to market, brand loyalty, instant gratification. And notice how low on the scale increased revenue was. That just seems so incongruent with how perhaps like a CVS might be looking at things. They're looking at this from an increased revenue standpoint. They already have on-demand access and satisfaction with care locked up. And so I would like to invite the rest of the panelists to react to some of these things too, because I know they have interesting thoughts on brand and how that impacts revenue and conversion and all of that. So yeah, you guys' thoughts, jump in.
Go for it, Rob. I can see it.
Well, I'll tell you, again, for those that know me, I have all my Robisms, and retail has learned healthcare faster than healthcare has learned retail, and we are facing disruption at a speed and pace that we've never seen before. And consumers As a client said to me a while ago, I thought was really interesting, share it with you, that it's not that consumers' expectations have changed, it's that now they're yelling at us. So what it means is their patience with us and with our excuses for not being able to do anything, they've lost their patience with us. Part of that is COVID, which has really unleashed the consumer, and I'll talk about that a little later on. But their expectations are, why can't you? Here's the thing that we've accidentally done because of COVID that has set expectations for ourselves. In just less than a year, we have gone from hardly anybody offering virtual visits to all of us offering virtual visits. We have now proven to the country, when push comes to shove, we can innovate. So it's making us look like we can't innovate, it's that we don't want to. And so that is a big change. We've just proven to consumers we can innovate when we have to. So now when they're like, why can't you do a single bill? Why can't you do online scheduling? We don't have excuses because we've now done it with virtual visits. So that's a big change we have to accept. And we actually did the change to ourselves.
Yeah, totally. That kind of goes to that data point about instant gratification now, right? Like we expect that from other brands that we interact with online. Why wouldn't we expect that from healthcare, especially after the last couple of years? So when I look at this data, when I look at this, I see like the systems that put their focus on some of these items that are in yellow and teal, those are going to be the systems that win, because the rest of the stuff should take care of itself.
Yeah, and I would just add, Lauren, that, you know, I think about it in terms of, you know, what would a provider answering this questionnaire be focused on? And I feel like we often find from the provider side that we're obsessed with the things that seem so difficult that we can't do. So it's the, you know, how can I give people faster access to physicians? But, well, do we really have access, or do we really have capabilities? And so to me, the most urgent issue is reducing the barrier. And back to your point, the problem is our competition isn't even thinking that way. They've got providers, they're ready to provide access to care. And so they're already in delivery mode. And so I think as providers, one of the things that we have to do is we have to have a fraction of our thought focused on how quickly can we get people in the door and start working on the increased revenue and instant gratification and conversion, and not entirely focused on trying to solve the problem of how do we make sure we have access to every physician on our staff or all of our primary care. If I've got a group of primary care providers that have openings and they're ready to go right now, they should be first in the funnel to get these patients so that I can start getting my kids in to get their medication or whatever they need during the school year, instead of let's not launch anything until everybody's ready to go.
Yeah, I think that's a real shift for, you know, it's just a mentality that really is different in terms of how provider organizations have, you know, traditionally operated, right? It has very much, Mike, been a let's get it all figured out and then launch. And, you know, it's a very different environment for those retailers and those tech companies that are used to an agile environment. They're used to that. Launch it, iterate, shift, you know, optimize, keep moving forward. And I think, you know, really from a just a mentality standpoint, an orientation standpoint, and I do think this relates back to brand, is, you know, it's a consumer first mentality versus an us first, right? We tend as providers to think about things from an operational standpoint, from a how are we going to A, B, and C, versus a how will consumers consume, right? How will they receive care? How will they buy care? How will they be thinking about things differently? And so we really have a lot of unlearning to do. I've been listening to a lot of Adam Grant lately, right? And you know, just think again, think differently, and really challenging ourselves in our leadership meetings at the provider level to question our assumptions and really, you know, flip the focus, if you will.
I
Well,
agree.
the definition of complacency is increased revenue being second to last. I mean, that is the definition of being complacent. And on top of that, maybe it's not flipping it to say, okay, what about lost revenue? If you're not worried about consumerization and what it's going to do from the standpoint of you being able to grow revenue, what about just losing it and recognizing that it might be due to many of these factors? But you're entirely right. I mean, I really think that this is about brand. It's about complacency, and that combo, I think, has put this in this issue of it's something that's happening to us, not something that we're actually participating in and recognizing is important.
Yeah.
And I'll jump in there, Dean, because I think when we look at the question, what does consumerization of healthcare mean to you? For health systems, for providers, they maybe have not recognized that the consumer is the one making a lot of these choices now. And that is different for them, right? That's been physician driven. Their paychecks don't come generally directly from consumers. They come through payers, right? So the mentality, again, of how do we think differently because of things like high deductible health plans, right? That managed care environment that says all care will be directed, and therefore the only thing I have to think about is my physician referral, pipeline. That again has been flipped on its head, because with a high deductible health plan, I'm not going to hit my deductible anyway. I'm going to make a choice. I'm going to start shopping differently. And Rob, I know, we've done some research together that has shown consumers are firmly grasping that decision-making authority. They're really taking it.
Yeah.
And that is an awesome segue. Do you mind? Sorry to jump in. But yeah, Mike, if you can pull up the next slide, because that's exactly what we're talking about, is price shopping. So yes, thank you, Rob, to your research that you provided on some of these things. So you found that 20% of consumers are price shopping. That's not surprising. I'm a little surprised it's not more. And then most of them are choosing the least expensive option. However, only about 75% of healthcare systems have pricing on their website, which is a transparency issue. It's a trust issue. It might even be a legal issue. And that's going to create, it's either an opportunity area or a barrier area for hospitals and systems to overcome. And then of those that do have pricing on their sites, most of them are using PDF or Excel. And I don't know about you, but the number of times I've ever pulled up a PDF or an Excel spreadsheet on my phone, I have never, not once ever, said, wow, what an amazing user experience this is. How helpful. So, there's some things to be fixed here.
I was going to say, and not to mention that when somebody asks me to look up a PDF or an Excel on a website, the first thing I think of is, what are they trying to steal from me?
Oh, that's a good point.
Yeah.
Yeah,
and I'll tell you too, in other work that I've done, price transparency or lack thereof is really hurting consumers' trust in us. They think we're hiding something. And then when they start digging in, they say, okay, you say you're a system. I need to get an MRI. It's $2,000 at your hospital, but it's $600 at your outpatient center. What are you pulling on me? So they're digging in more, and they don't like what they're finding. So we don't have good answers for them. So price transparency is a real challenge, and it is hurting our trust levels.
And it's one of the things that I think the disruptors are really zeroed in on, because if you look at anything that Amazon or Walmart or CVS has done, they're always saying, primary care visits from $25, or your vaccine, the flu. Well, obviously, CVS is free, or COVID shots are free. But the point is, they really zero in on what's this going to cost you. Whereas sometimes when I go in for primary care, I really am not sure exactly what I'm going to be charged.
Yeah,
right.
that contrast is huge. Oh no, I was just gonna say that contrast is huge, because the consumer is also not just thinking of price, meaning the surprise bill at the end. For them, it's also just the cost of acquiring care. So it could be the fact that, look, I can get my allergies checked out at a doc in the box and pick up my prescription and pick up a bottle of wine and some combos and walk out at the same place. And with gas and other prices, I could do that in a one-stop shop. That's a very different cost benefit analysis for the consumer that they do very quickly in their head versus I'm going to go walk into the doc. They're going to take especially the ones that literally will take your, the digital version of your credit card impression with a, cost to be named later. And then you still have to go pick up the other things and whatnot to get that total care. Just for that simple, immediate treatment, it's that total cost of goods sold for that consumer, and they're willing to do that calculation very fast.
Yeah, exactly. It's the cost to the consumer. And then also, I mean, isn't CMS going around and giving people fines right now on not being transparent about, I mean, like, it can actually cost you money. You can get slapped with a lawsuit. So it's, very avoidable. And it has other benefits too, like having that stuff in a particular part of your nav on your website. It gives you SEO benefits, which we also, I'll talk about this later, but we also saw was like one of the big tactics that systems are using. So it's like, great, this is an opportunity. Price transparency is an opportunity for you to beef up your SEO and build that trust again, and get people in the door.
And the other thing I want to add, and this gets back to what we said earlier about access. We in healthcare, it's got to be like everything or nothing. So, either we have everybody that has online access to be able to make an appointment, or we can't share anybody's online access to make an appointment. And I feel like that's the way it is with price transparency. When I think about price transparency, I know that there are some service lines where it's very difficult to generate what is the cost of a cabbage, or what is the cost of, oncology, radiation treatments, and those kinds of things. But I think, when we start to look at PDFs versus non-PDFs, that when you think of the bottom 80% of what type of healthcare consumer is coming to your website and looking for cost, it's not as difficult to pull together some of those primary care numbers. And so I think looking at this as pieces and parts as opposed to everything all at once is a possibility, or multi-format. Instead of everything in a PDF or everything in an Excel file, the most important thing, we're marketing people. I mean, that's what I would be promoting. I'd be promoting what are the things that people are going to access and make those decisions on most often. And those would be the things that I would have in the forefront.
Totally.
Yeah, I'll have to jump in here though and say that I think for some, this is a fundamental, this issue goes much deeper than just sharing what the pricing is. It's the fundamental model of how we make our money right now, right? And so if we have been structured to run most operations as divisions of our, flagship hospital, and therefore our price structure and our margin structure and our revenue structure is, not advantageous in terms of competitive pricing, those issues have to get fixed too, right? So I think part of the challenge here is that the disruptors are modeled to have a fairly simple cost structure, right? They're focused primarily on primary care, at least on the surface. They're certainly going after chronic care and some more complex downstream types of revenue models as well. But for a hospital system, a health system that has their pricing structure, this gets back to what business are we in and how are we structured? Because if everything has been figured out as the hospital as the center of the universe and how we make our money, some of those issues have to get fixed first before I think some folks are feeling comfortable about posting those prices, because they know once they do, they're not going to be competitive. So there's bigger issues underlying it, but for sure, what you can, again, to your point, Mike, do what you can, like at least get going on this stuff. And I think that's a general statement that we've observed, is that reluctance to move forward unless forced, like have these work streams that can really get you moving down the path, I think is something to think about.
And I'll tell you, to add to this, I know, Dean, you've done a lot of work with by age groups, and I have too, and especially the Gen Z. many of them are going uninsured, not because they can't afford it or they think they're going to live forever as we think, but they are calculating the numbers and they're doing a trade-off. They're saying, I know health insurance is really expensive and I still have a big copay. I'm probably not going to get sick for the next 5 or 7 years. So I'm going to take a risk, a calculated risk, go uninsured, and I'm going to pay cash and do a virtual visit. I'm going to go to like a City MD type of urgent care for that type of care. And so it's a calculated risk. They've run the numbers. These are smart folks. They're running the numbers and saying, for the next few years, I'm going to go uninsured. Every year, they recalculate the cost, benefit, and risk ratio. So that means they are so much more price conscious because they're moving from just a passive patient to a proactive customer. And that's how we need to start looking, especially as we try to adapt ourselves to be relevant to the next generation of healthcare consumer, like the Gen Zs.
Agree.
Yeah, totally. And speaking of how generations maybe use healthcare websites, I want to have a couple of data points here too on how they're accessing care. So Rob, again, thank you for some of your research. You told us that about 26% of consumers are using voice search for health-related information. I'm going to guesstimate that that's only going to go up, especially amongst people who are disabled or temporarily abled. However, we found in our research that 64% of systems don't have any plans to implement voice search over the next couple of years, which is interesting to me because how many times do you like, hey Siri, where can I go get X? You know, my kid just broke his arm. What's the closest urgent care? And so systems are potentially missing out on understanding where those visits are coming from if they don't have first voice search installed, if they don't have some sort of tactic for that. And then the other thing that we found was interesting, go ahead to the next slide, Mike, was personalization. And this is something that we talk about with our clients a lot. It's kind of always on the wish list when we write a scope of work, and then it sort of fizzles and dies out. And there's probably a million reasons for that. We said earlier that a lot of systems think we have to do it all at the same time. This is a huge undertaking. And from our perspective, we recommend that you kind of take it in a bite-sized sort of approach. But Rob, you said that 26% of marketers are feeling that their organization is like kind of okay at meeting the goals of personalization, but most systems don't have any plans to implement it in the next couple of years. And this can be done in such a, like I said, like a bite-sized way, like pick a couple of things to focus on and show that ROI and build on it, because we know from implementing it that it is an undertaking. It requires a lot of care and feeding. But it's something that we're going to have to pay attention to, because that is really, it really is the engine that drives consumers. We're used to having personalized experiences. I don't know about the rest of y'all, but if I don't have a personalized experience with a brand that I'm interacting with, it actually frustrates me. Like, oh, you should know me by now, so yeah. Thoughts on these?
Oh. Yeah, I have a big thought. This one kind of drives me nuts because we kind of act like personalization is a new concept, and one-to-one marketing's been around forever. Does anybody remember Don Peppers and one-to-one marketing? That might have been pre-internet. And so this whole concept of one-to-one marketing and personalization, it's as old as the hills. We're late to the party and acting like we've just thought something new. And so I think this is such a critical component. I'll tell you, in the brand work that I do, one of the big factors that makes a patient strongly attached to the brand is that the brand knows them and they feel connected and bonded to them, and that they act like a system, meaning the left hand knows what the right hand's doing. So they feel like they're in one organization and not a bunch of different ones that are cobbled together. So all my research has demonstrated that this yields what I call ROBI, return on brand investment. And so we can't keep whistling past that graveyard.
it's a two-way street too, because we hear constantly and are told, in fact, are opting in constantly to giving the health system or the brand more information. And the irony is we don't see them using it for our good, at least, not in an obvious way. It's like, you actually know so much about me that you could be using for personalization. And yet your choice not to, again, starts to reflect on the complacency that you have as a brand, that I have to come to you. And I think that again, I feel like everything we're talking about here is where, it's an industry full of wizards in the Wizard of Oz, and we're frustrated that everyone now is Dorothy. Like, we're frustrated that people are too smart. They know that to look past the smoke, and we're kind of semi-angry about that. Because we've been living off behind that smoke, the entire time. And this personalization to me is, Rob, I feel the exact same way. It's frustrating because A, it's not new, and B, we've been collecting, stuff that we could actually be using, and choose not to, which says more about us than anything.
And I would say, and I am going to sound like I'm just some robot that keeps spitting out the same information over and over, but it gets back to that whole thing of carving out where you can be good at this. Because I feel like with personalization, there's an enormity to that. Because in the world that we live in today, I think it gets associated with the technological capability to provide personalized care. And a lot of times that relates to something like CRM and how we're going to integrate it with our existing data. And that's such a giant thing to think about. And I see so many of our peers get obsessed with having it all done and perfect before we're going to launch it, as opposed to, let's take the 80% of the people that we get on an everyday basis and work on personalization for those services that they're accessing, and work on that first before we get to the let's figure it all out and have everything all ironed out before we launch anything.
Yeah, I think that's really true. I think it's overwhelming. It can feel just incredibly and it is. It's a huge undertaking. But, I think, Lauren, it could be really helpful for you, maybe for our audience, to just outline like some of the ways that people could actually start doing some of these types of things. Like, let's get practical for a second here, and say, what could some of these health systems start doing without fixing everything all at once?
Yeah, sure. So a couple of things that come to mind for me. We've seen, if you can't go down the road of a full-blown personalization strategy, start with some really good localization. Because if you're on your phone searching for care, it could be emergent or it could not be. That can even help your team and your system kind of get used to that as a tool, as a concept, and show some ROI and use that as a building block. I would also say too that something else that might be sort of, a lower lift tactic would be to invest in a really good chatbot and some great AI. Sometimes those platforms will come with some really robust tools in the back end that will help create a more conversational experience for your patients, and all of that. And it doesn't require someone to just be like full-time care and feeding of that. It's an API. You plug it in, you work with the provider, work with us to make sure that it's, giving the right user experience across the board. But it's not that humongous lift that personalization really can be. And that opens up the door for systems that maybe have a lean and mighty team to take advantage of some of those things. So it's infinitely doable with the right tools and stuff.
Yeah, no, those are great practical suggestions. I think that's really helpful.
Yeah, and to Lauren, to that point, all the website research that we do with Mike and Greystone is really showing that consumers want real-time dialogue with you. The days of, send in your message and we'll get back to you within 1 or 2 business days, those days are gone. So exactly. We tell clients, is your website built for the speed of now? And so we've got to have a way of interacting with them. This is a digital brand dialogue they're having on the website. Websites are more important than they've ever been They're not just patient navigators. They are customer acquisition tools. They are brand building tools, as our research is clearly demonstrating. So that are you built for the speed of now has to be something that everybody has on their wall as they're designing their website.
I'm going to put it on my wall. I love that. Are you built for the speed of now? Do it right now. I love that.
Yeah.
Good segue. Yes. So yeah, one of the other questions that we asked was, in light of all of this, what are some of the changes that you're anticipating making in the next 12 months? And so again, there were some things that stuck out as table stakes, some things that stuck out as opportunity areas, and some innovation areas as well. Personalization, definitely an innovation area. Again, we get how hard it is. Take it slow, bite size, use some APIs to get you started. But the thing that stuck out to me was this increased focus on SEO, which I think, like, yes, absolutely, systems should be focusing on SEO. That is just generally a best practice. But if you think back to some of the things that we just talked about price transparency, I would even say, transparency around what insurance carriers you have. This is a different way of thinking about SEO, not in just terms of how you're going to show up in search results if someone's searching for a knee replacement, but how are you really serving the consumer that is price shopping you, that is figuring out if I can even go to your hospital. So that is both table stakes, but also some thinking shift could happen around that could really get you further down the road. Localization, we mentioned that, and then consumer-centric brand refresh, that stuck out to me as like, okay, there's a good percentage of the respondents were looking at that as a big change. But then if you think back to some of the data that we showed just a minute ago on how low they valued brand as part of consumerization, it made me wonder how they're really thinking about brand, and if they actually mean like visual identity and not brand as an experience, rather than our colors and our logo, and we're just going to make it more friendly and some better imagery on the homepage. Pricing, content, and strategy, again, table stakes. And I don't know, something else. I want to ask, what is your something else? I am now curious. So yeah, thoughts and reactions from my colleagues on this one.
The SEO thing, I think, to me is interesting because I think it's twofold. One is it's actually interesting that it's SEO and not SEM, because it's this mentality that we want to help people who want to find us, as opposed to understanding that there's people looking for a reason not to find you. They're looking for alternatives. And so it's kind of interesting on that from a cynical mindset, if I may be Gen X for a moment, skeptical or cynical, that kind of turn. But the other thing that's interesting about that is also where they will see very quickly what disruption has done to their landscape, because they're not just competing with a hospital down the street for that information anymore. They're competing against CVS search ad dollars and CVS search optimization, and also, where are people searching? Are they searching on TikTok? Are they searching on Facebook? Are they looking for who has the best reviews or the experiences they've got? There's so much else that's going into this that, again, it's sort of whether you're thinking of yourself as that, massive library of information, that way they can just stumble in, as opposed to thinking of, okay, how do we actually convert these people into patients so that we're the right place to go to, not just expect them to. And I think that's also just it's like not thinking of consumerism as just a way to care about people before they become patients. Like, just that frame of mind, I think, would change their attitude. But the good news is SEO is going to show them how different, like how everything has shifted, I think, if they really are focused on that.
Yeah, totally. Like, my dad's having knee replacement in December, and I'm going to be his caretaker during this. So I'm like searching knee replacement, recovery, and all this kind of stuff. And what I'm getting is from like Cleveland Clinic, Mayo Clinic, definitely not the hospital that he's going to have his knee replacement at. I bet if I searched you know, a super long tail, I could get there. I'm assuming that they have that information on their website. I haven't tried. I will do that right after this. But yeah, exactly. Like I want to, as a caretaker, I want to know that where he's getting his knee replacement is a thought leader on this, that he's going to get the good care. I know Mayo Clinic's got this locked down. I want to know that his hospital does.
Yeah.
Yep, that's right. I think your point to Lauren about this, what do we mean by a consumer-centric brand refresh as it relates to website changes to appeal to consumers, right? Like that opens up all sorts of questions from my perspective as well. Like, what do we mean by consumer-centric, and are people making assumptions about what that really means, or are they starting from a place, as we always recommend, you know, of really finding out locally what are the expectations, what are people really looking for? You know, I think this is an opportunity to give a plug to my friends Rob and Dean to really, you know, find out first before you go making those investments, so that you can at least have some, you know, there's some quick ways to get a sense of where those opportunities make the most sense to invest. And I guess the other piece that I would say is thinking about, you know, your brand, as you said, it's not just about look, feel, is it easy, but it really thinking about that patient experience. And then I'm going to bring in a whole nother point that we're not going to be able to explore today, but that systems also need to be thinking about their teams and their own employees as consumers, and their own internal, you know, communication, and the way that they are thinking about their employees also as consumers. You know, they're often one of the largest employers in the region. Their own employees can serve as kind of a test case in many ways of testing kind of things, and just really embracing this sense of how, you know, are we thinking the same way internally as well as externally, right? So at Core Health, we like to say it, live it. So don't say anything externally that you're not prepared to live, and that means the brand experience as an employer brand, as well as you know, for consumers and patients. So that's a big old topic.
Yes.
Maybe we have another webinar about that.
Oh, I would love to dig into that. Yes.
Yeah, taking notes on that. Just so kind of coordinating the next 15 minutes, I don't want us to run out of time, but Rob, I did want to highlight some of the findings that you and Laila and Dean had from your research. And so I'm going to pull up a slide just kind of based on some of the things that you learned with consumers and patients. And maybe, if you don't mind, can you talk to this for a second, and then we'll leave a little time for questions at the end.
Absolutely. So an important concept that we really uncovered in our research that affects all of us marketers, whether it's traditional advertising, digital advertising, website, any way that you dialogue with your stakeholders, is that COVID brain is real. And I don't mean you know, medically. Well, you know, that's another discussion. But all of us say, "Oh, I've got COVID brain. I can't remember this." We forget things more. So what COVID brain has done is all of our brains, like think of them as CPUs, they're overheated. So our cognitive processing is diminished right now. And what that means is it's impacting people's memory, their attention span, unfortunately their patience, as we're seeing on flights and in even on the road. And it's also affecting brand linkage. People are remembering advertising, even the message, but then they can't remember who it is. So I'm seeing in all my ad recall studies, brand linkage is in the toilet right now for everybody. That's a challenge. So what that means for us as communicators, using a broad term, communicators, any type of communication must be simple, engaging, repetitive, and the brand must be the star. So think like Geico. They're really good at interacting and messaging a consumer group that's not paying much of attention. So Mike, do you want to go back to our?
Oh yeah, sorry.
So that's as communicators, we have to make sure, whether we're creating a TV ad or digital, or we are working on the website, simple, repetitive, catchy, or engaging is absolutely critical. And we've got to make sure our brand is the star. There's nothing wrong with having the brand, the star, in our messaging. Laila, any other thoughts on that?
Nope, I think you covered it. Yeah, we want to make sure we get through these.
Yeah.
Yeah.
And disruption. COVID's taught us that we can get everything delivered to home. So why not healthcare? The top 3 disruptors that consumers were most interested in were hospital at home, urgent care at home, and home monitoring of chronic conditions. So for us to be spending all this money on a lot of brick and mortar and building all these new hospitals, consumers are like, no, you bring to me. So we're seeing a resurgence of the days of Marcus Welby, MD. Back again, I'm showing my age with that reference. But
is he an NBA player?
Yeah,
yeah.
What's old is new again, and so we have to embrace. We're going to experience more disruption in the next 1 or 2 years than we've experienced in the last 20 years. We've got to embrace the retailization of healthcare, or we're going to find ourselves with people saying, "Oh, I've got an Amazon doc." Or I've got a CVS doc, and we're going to be outside looking in. And the mental health crisis. I mean, what more do we need to say? It's here, even especially with children. So we have got to address the mental health crisis. Here we're seeing the disruptors coming in. I'm seeing so many ads on TV for online for phone apps for getting mental health access. So the outside disruptors are coming in, just like the MD Lives and the Amwells and the Teledocs did to virtual visits. Now they're doing it in mental health. So technology is happening to us, not by us, and it should be happening by us. We've proven it with virtual visit that we've been able to innovate when we have to. And it's about empathic access to care. People want, and I think Laila, you mentioned this earlier, it's about I want access when I want it, where I want it, how I want it, and with whom I want it. Another Robism, time is the new currency. You can always make more money, but you can't make more time. We've all lost 2 years of our lives, and we're never going to get them back. So people have lost their patience with us, saying, oh, you need to wait 3 hours before our doctors are running behind. What we don't realize is so many people are hourly now. They're clocking out to come to an office visit. So if we make them wait, they're losing hourly wage that they're never going to get back. So the cost of healthcare is bigger than just a copay. And more effectively connecting with younger consumers digitally, because that's where most of their decision making and experiences are happening. It's a whole new ball game. So we've got to meet them where they are. They may not have a need for the big expensive care that we want to provide, but a brand has to invest in a customer before a customer invests in them. That's been that way forever in any industry, and it's no different in healthcare. So we have to invest in them so that they want to come along on this journey. Think lifetime customer value. We got to play chess with these folks, not checkers. So we need to think several moves out. Honesty addresses the equities and access barriers that exist in healthcare. The top things that consumers want in a brand, I want a brand that is authentic and genuine. Think Bombas socks and all of these great brands out there that do things to help and give back to others. They don't think we're very authentic. We should have been the inventors of authentic as an industry, and we're not. Address billing issues. We talked about upfront pricing, but back-end billing is critical. That's where we're losing people. No matter what you do on the patient journey, when you screw up the bill with these folks or make them wait, we lose everything. So I was doing billing research before COVID. Here's the 2 things people wanted. I want a single bill. I'm tired of being your damn accounting department. You pay all those people. Don't make me do it for you. And number 2, if you can't send me a bill within a month of care, I shouldn't have to pay it. People are sick and tired of getting bills 6 months later. They think you're pulling a fast one on them, that you don't want them to look through it. You'll just pay it. So our trust is being very eroded with, if we don't fix billing, I don't care what we do in the patient journey, we're going to end on a really, really sour note.
Rob, I want to build on that and actually the honesty point too, to say it's interesting that when we talk about those things on the healthcare side, we call it transparency, but the consumer calls it honesty and authenticity.
Yes.
And I think that if we took their mindset, it would change a lot of decisions.
Mm-hmm. Well
Okay, so
said.
look at what does the opposite mean?
That's right.
Yeah, it's a
That's
really
it.
good.
Yeah, it's great.
Cool.
Thank you for running through those for us, Rob. That
Yeah,
was
thank
great,
you, Rob.
great quick
Thank you.
summary. Yeah.
I'll just plug too, while we're all on here, that if anyone on this call is coming to HCIC, Rob, Laila, and Dean are going to be presenting on this topic at HCIC. So make sure you put that on your calendar and hop in, and they're going to dig a lot deeper into the study and talk more about consumers and patients.
Yeah, it's going to be great. Masterclass on the Monday.
And it's a workshop, so we actually will work. We won't just make you depressed.
That's right.
Also
We're going to work
try
through
to,
solutions.
yeah, work through some solutions with you.
That's right.
So I know we have a few questions, and Farah, if you're on, if you can run us through some of the questions that have come in during our presentation, that would be great.
Yeah, sure. So I'm just going to throw this first one out, and the first one to the buzzer can weigh in. So this is, it says, personalization gets talked about a lot, but implementation and adoption has been slow. Is this really a missed opportunity for healthcare? And is the ROI really there?
Ooh, good question.
Yeah, so I think we kind of touched on this earlier, is that, yeah, it is a missed opportunity. The ROI is there. It's just a matter of taking it slow and choosing what is really going to move the needle. So what we see is, identifying what problems you're trying to solve through digital and running some experiments. And like I said, like you can find these platforms and partners that can really help you kind of get there without a huge list on behalf of your team.
Yeah, and I would just add that with the way that technology is kind of helping pave the way for personalization, it also has created an environment where this is the most trackable we've ever been. I mean, when you know who you're marketing to and you know how they react to your marketing and you can trace them through the funnel, you've got rock solid data. So in terms of ROI, A, the ROI is there, but B, you can prove it, and it starts to give you that capability to be able to fund something bigger and greater over time, because you can start to really show the results.
Yeah, the only thing I would add to, oh, sorry, go ahead.
Go for it, Lauren. Go for it.
Yeah, I was just going to say, I think Lauren's point, it was made briefly, but it's really, really critical, is doing some of that upfront pause for poise, right? Really stop to think about, where does personalization actually have the opportunity to have it, the biggest impact, as opposed to spreading it like peanut butter across everything. There's going to be, when you're making those choices, to be really thoughtful and strategic about, let's try it here first, or let's, here are the two areas where we know it's really important to consumers, and that can be verified, I would say, through some quick research. But Dean, go ahead. I'm not sure where you were going with it.
Well, no, my other point was, look at how much money and time you spend targeting. Why don't you use that same energy when people are inside your house? I mean, just start there. Look at your biggest, broadest segmentation. Start the ones are great for conversion, and let that experience follow through once they get to you. That's the irony about even talking about, is there ROI and personalization. I could just say to basically anybody, you tell me, do you target your marketing? Because if you do, you already know that personalization is, as a concept, is already proven. So I think that Laila and Lauren are completely right in saying, it is about, not trying to be everything to everyone. You don't do that with your marketing either. But maybe some of those more successful areas in that way, you can take that same mentality and bring it inside.
Great.
Great. Lauren, this one came in for you. When you were discussing kind of the things to start with, this person asked, what did you mean by starting with location?
Localization?
Localization, yes.
Yeah, so localization is a tactic that we've used for, I mean, we use it for B2B brands all the time, actually, even insurance carriers, so kind of related. But that's just the concept of being able to read an IP and know about where they are in your geographical reach. So if you're a large system, for example, that's covering most of a state, recognize that this person is, 5 minutes from this hospital and 65 minutes from this other hospital, and serve them up those locations where they are most likely to be able to actually get their care. It's related, but a little different than geolocation because it's just built into the website. So that's a great place to start, and we've seen a lot of success with that.
Yeah. So things like urgent care, things like, I mean, it's
Yeah.
It's
Doctor's
what
offices.
retailers, restaurants are doing this all day long. So yeah,
Yep.
Exactly.
borrow from the retailers.
Yes.
Here's another one for the buzzer round. So have your hands on your bells. So to what degree will health systems have to shift their branding positioning to compete? And is this an overhaul or is it a quarter turn?
I think it's going to depend on your current competition and how you're built to operate right now. Because I think that, the idea of trying to, punch at if you're a number two and you're trying to constantly punch against the big gorilla in town versus maybe you're the gorilla, in some cases, it's just a very different fight when you're fighting against a national brand who's potentially taking away market share, at least from a primary care standpoint. And I think that then also just goes to, where is your brand actually at? Like, what is the current, where's your brand truly at right now? Is it as brand centric, as systemness centric as you think? Is it much more facility centric? If so, what does that actually look like? I think just even on getting your hands around that is an important first step to really understand where you're at, and then where you're at against more than just your usual suspect competitors.
Yeah. Go ahead, Rob.
No, go ahead. Go ahead.
So I would just say that we have to take competition into account when we're positioning our brands, of course, right? There's nothing more important in competitive strategy than, the brand can be a really important lever in that. But I would also caution against constantly reacting to the competition. Like, you have to figure out what your path is forward, and then based on that, how do you then respond? Because the competition is going to keep changing and at a very rapid pace. So to develop a brand strategy that is in opposition to, I think we would recommend figure out who you want to be in the market, figure out where, the current players are and where the potential players may be, but know where you stand and what you're trying to do, rather than constantly trying to shift your brand strategy. It doesn't mean you don't do some very responsive things and that you can pivot and, activate certain initiatives against competitive moves, but your brand needs to be your brand, and it needs to be fairly steady and invested in. And I think Dean is exactly right. And I think Rob would say the same. Get a good sense of where the health of that brand is right now and where your competition stands. And revisit that, because who you have been might not be who you need to be moving forward, for sure. Rob, anything?
Yeah, there's three components of a strong brand. You have the brand promise, the brand architecture, and the brand experience. And so those all have to be in sync. You can have a really strong brand promise that attracts new patients to you, but if you fail in operationalizing or living that brand promise, then that's a challenge. If your brand architecture, if you're really structured as a house of brands and not a branded house, then you can't, and you want to be a system, well, then that's incongruous with being a strong brand. So you really have to understand, as Laila was saying, you got to know where the brand is and where the strengths and weaknesses are. Some of our clients have a bad brand promise that people don't even know why they should care about them. So they have what's called an acquisition challenge. Others with the operations, they have a retention challenge. So it's really identifying. In fact, in our brand research, we're finding that a lot of clients, they think that marketing's a panacea. Oh, we can't get patients in, let's just do more advertising, which sets everything up to fail. And so we're finding the handoff between what marketing's doing to create really marketing's job is the first date, and operations is the marriage. And so you have to have both doing their job, and neither can do either's job. And so a lot of the challenges, access has to be our mantra today. If we don't get a handle on access, the best ads in the world, all they'll do is create more problems, because they'll bring more people in and they'll all start, like that band in Animal House, they all just crashed at the end of the wall, and they all crunched up. It's just more and more. And yeah, another old reference. But we create a problem that way. So if marketing and operations are not working together, that's another silo problem that we have in healthcare.
Yeah, I just want to finish that by saying I couldn't agree with you more. And I go back to what we're really talking about is the delivery of care. I mean, it's reducing the barriers and getting people to see a doctor quickly. And Walmart didn't come in because they're the healthcare leader in the world. They came in because they can provide a service very quickly, and that's what they've been doing with selling products for years and years. And healthcare, it's not retooling your brand, it's being able to live up to the brand promise and being able to then deliver. So if you can provide access and you can provide high quality care, you're going to win over Walmart. But the problem is our delivery has been poor so far. So as providers, I think that's the first domino that has to fall. And then the branding issue follows beyond that. But you've got to be able to deliver the product.
So I think that's a good segue into a last question. So I'll challenge everybody here for like a 30-second to 45-second answer.
We're not very good at that.
It should go well.
Because Mike addressed it there kind of at the end of his statement. But are systems ready to have their brand go toe-to-toe with a national one?
So the answer I would give to that is that depending on your footprint and depending on what your aspirations are, you don't have to compete nationally, right? You have to compete where your patients are. And so, not being intimidated by that at the outset, simply by virtue of you're going after a national brand. Again, this goes back to who are you in the market? Who do your patients, your consumers, your employees need you to be? How well is that matching up? And, it's a good question. It's one that has to get answered, right? I don't know what the answer is to whether any individual brand is prepared to compete, but is the question, can they compete? Absolutely. Absolutely they can, but they need to know what it is they're trying to do, who they're trying to do it for, what those people care about, and how are they setting themselves up to deliver. Like, Rob really summarized it really well.
I would just say you first have to go toe-to-toe with your consumer. I think we get really distracted by our competitors, whether that's the disruptors or whether it's about did that local competitor put that same ad in that magazine? We've got to do the same thing, and we jump over the consumer. So I would say first, if you can satisfy the consumer, you're on your way to competing against your competitor.
Well said.
Yeah, we love to chase our tails in healthcare and overreact. So I would answer it this way. Think Hertz versus Avis. I have a lot of Avis clients that always want to be Hertz. And I'll tell you, I talked with the brand manager at Avis years ago, and he said the biggest mistake they ever made was thinking they could overtake Hertz. In sports, we only care about who won the Super Bowl. We forget who lost. They're just the first loser. But in business, you don't have to be the biggest at all. You can make a ton of money and be successful and have people love you by being the second, third, fourth, what have you. So having delusions of grandeur about your brand can really cause a lot of problems. understand who you are and how to best connect with the consumer. Because if you really do a good job focusing on the consumer and not the competition, then you're connecting the way you need to be, and that will optimize your brand. You don't need to maximize your brand. You want to optimize it, and that may be being Avis. They went back to trying to say we're number 2, but we try harder, but they really lost it. They went from number 2 to number 4 almost overnight because they got cocky and they thought they could overtake Hertz. So take Hertz off your radar if you're an Avis, and just be the best darn Avis you can be.
Great. Well,
Yeah.
I'm going to have to close us out here. We're over time. I want to thank everyone for joining us today. If we did not get to your question, we can reach out and answer you on an individual basis. If you have any questions for any of our panelists, feel free to reach out to them. Their information is there on the screen, or you can contact me and I'll get you in touch with them. Please remember that we do have a survey at the end of the webinar. We'd really appreciate your feedback. And I'd like to thank Reason One for bringing us all together today and for sponsoring our webinar this month. And we hope to see you guys at HCIC in about a week and a half now. So thank you again, everybody, for joining us, and to our panelists for today.
Thank you, Kara. This
Thanks,
was
everybody.
such a pleasure and so much fun.
Thanks,
Great
Lauren.
fun. Thanks. Bye-bye.